two, one.
Hello, hello, and welcome back to my now much more regular live streams every week. So, what I've been talking about for the past couple of weeks are just vaginal symptoms, uh, mostly centered around things that can be helped or improved by vaginal steaming. But the live stream from last week about bacterial vaginosis really struck a chord. One of the people who I struck a chord with is on the call today. Miss Cassandra, do you want to introduce yourself? Who you are, what brought you into this work type deal?
I'm Cassandra Woods. I'm a midwife, and I came on when I saw Javon talking about BV, and my question to her was, is it sexually transmitted? And
Yeah.
so that was a little bit of a debate we were discussing
Yes.
um, about that, and is it possible for it to be sexually transmitted? And so then we have a, you know, um,
An hour long conversation from what I remember
just
about
say you can
all
say
the intricacies, all the things that we can talk about when it comes to BV because it's a pretty big topic, right?
it is huge, but is it sexually transmitted? And our students taught nurses and midwives and all are they taught that it is sexually transmitted? Um, but there's a sexually transmitted component.
Exactly.
It
Exactly.
is part of vaginitis, but trick is part of vaginitis too, and it's sexually transmitted.
Yes.
So, um,
Yeah. So I could talk about my perspective. So first of all, you had an article that and I don't know if you found it. You don't have to have found it, right?
let me look it up because I'm gonna post it. Yeah, and I reposted it out for everybody to see. I dropped it in some group, but yeah, there's some. There was something about that. You can keep going. I'm just looking for it while we talk.
Okay. So I could just share my perspective on it, or like what the evidence speaks to me, or whatever what the technical terms is, because for a while nobody really we would always say this isn't usually because the main symptom of BV, and we can get into this and then we can get into some other topics related to BV because we covered a couple other ones that I did want us to bring like circle back to.
Mhm.
But when it comes to is BV a sexually transmitted infection or not, the answer is sort of. It's not necessarily like the case that one organism.
I found it.
Okay,
It's in
cool.
the
So
Cleveland,
you can
the
share.
Cleveland, the Cleveland Clinic. Excuse me, a
That's
Cleveland
all I'm
Clinic. Oh, Cassandra, stop. But
here.
I found it. So it says that bacterial vaginosis is a common vaginal infection that happens when some normal bacteria that live in the vaginal outgrows, and it's an imbalance. And we go all the way down there. But the symptoms include, and we already know what the symptoms include,
Let's just
but
review
it's
them real quick. Let's review them real quick for people just in case this is the first time they're
which
watching.
one? The symptoms?
Yeah.
The symptoms include an off-white gray, off-white or gray vaginal discharge that smells fishy. I kind of say it smells like trash, but
Yeah.
um, it's offensive. It's a very strong offensive type of odor. It's easily treatable with antibiotics and from a healthcare provider. Now, the other thing with um with BV is that if a woman or who a person has sex, when they're having sex, they're gonna smell it.
Mhm,
When they go take a shower and wash up, they're not gonna smell it
mhm.
until some of the discharge comes back out and hit the air, and
Yep.
then you're gonna smell it. And so some people are like, well, I just, get some fruity or some rose smelling body wash and just wash it off, and that's gonna make it go away. But the body wash probably caused you to have BV.
Exactly. It
So
can make it worse. It can throw
yeah,
off your
yes,
throw
the body
everything
wash
off.
probably caused you to have BV. And so it says typically, it happens when, the bacteria is off, the balance in there is off. with the yeast infection, the same thing. When your pH is off, and your good and bad bacteria are not living well together, and so you're gonna get that. Um,
Yeah, so in both of those cases, though, right, there's an overgrowth of bacteria or yeast that's already there, right? These are
hmm
microbes that are already there, and there's an
hmm
overgrowth of them, which is why it's tricky to call it a sexually transmitted infection or disease, even though, right? Because a part of the reason why you had asked that question is because there are studies that support
There
um,
are, there
that
are,
the
there are.
cases where people who are having sex with the same person are tend to have more of that overgrowth, like that having sex with that
It's
person can throw your pH balance off if they've
so
had.
they're saying that it's rare. It's rare for somebody to get BV that's never had sex.
Mm,
So yeah, so it's rare. So this article saying it's rare for somebody to get BV that has never had sex. It's so so some people naturally produce too much of a bacteria that causes it, but the higher risk is for getting BV is a new sex partner
mhm.
or being pregnant um that you didn't use condoms or dental dam. You have IUD. um, an IUD or multiple sex partners, use douches or antibiotics can knock you off too. Now,
So, but
now
this is anything that is coming into contact with directly with
it's
your vaginal microbiome or causing a huge or potentially causing a huge shift in it, like antibiotics, right? So these are all the things that could potentially impact it.
exactly,
But
exactly.
there was also like at least one article that came out recently that was like, look, like there's some evidence that maybe it might help, especially with recurrent BV, if we treat your partner, which is something that has typically been reserved for a sexually transmitted infection. I think
That's and so that's what it was saying. I was like, treat the partner.
yes, everybody gets something.
Oh, yeah. It says bacterial vaginosis isn't sexually transmitted, but it's linked to sexual activity. Researchers think that sex may change the bacteria environment in your vagina. This makes the bacteria overgrowth more likely. Now, the somebody that's not pregnant, somebody that's not pregnant and they get BV and they keep having recurrent BVs and you treat and you're trying to figure out why it's refractory to what you're treating them with, it also puts them at risk for preterm labor
Yeah. Yep.
and birth. Also, there's some main signs they put on here for BV, but for some women, if they have a whole lot of spotting, a whole lot of spotting,
Mm-hmm.
and you don't smell the odor, but if you swab them, it could possibly come back for BV.
Yep.
And so they're like, that cervix is friable, so you're gonna get that,
Yeah.
and so you're like, well, where's the odor? It was coming. It's
Or
coming.
it's being masked by some other condition. Yeah.
Yeah, yeah, but that's
So,
interesting. Not all BV smells bad.
and not all of the foul odors or the smelly odors or whatever other
Or
people, whatever. Not all odors actually signify, right, that you have
yeah,
BV infection
BV.
either.
There's some other things that's a bit out there,
Hold on, let's
but
talk about it. Don't be doing that. Don't be
yeah, that's one thing. Um, a tampon lodged in the vagina,
huge,
a condom lodged in the vagina,
huge.
a sex toy lodged in the vagina.
Yeah,
Like,
anything that's just kind of sitting there, it
yeah,
really can, or
it's
like a
like,
gauze, right?
yeah, oh gauze, yeah, somebody went in there and they didn't get everything out and just leaving things in there. It it smells worse than the fishy thing that kind of smells like a dead rat. And
Yes.
and that
Yeah,
has to go in the trash can immediately and tie the bag up.
and take it
And
out.
yeah, you can't keep that in the room. You just have to hurry. Be
Yeah,
quick about it. Look, be quick about it. Get out of here. So,
yeah.
but that's interesting that you said that. So then, if anything that knocks off the microbiome or your bacteria there. So just from being touched physically with fingers could do the same thing
Mhm.
and do the same thing. And so it's important to have good hygiene, wash your hands, and all of that good stuff in your mouth and all of that. Well,
It can
and
help.
I've never seen it. I never seen it. I never seen BV be as bad as a yeast infection can be. Yeast infections can just be awful. But the worst thing about BV is eventually that smell comes through her clothes,
Mhm.
and it's embarrassing, you know. Um
So we actually talked about. I started talking about that too a little bit last week, but I that was one of the points that I wanted to bring up today because I know that we had talked when we were offline, just talking about just some of the nuances surrounding BV. And I feel like that was one of the biggest things, right? The potential shame, other people, partners, and things like that, smelling you and
mhm.
deciding that, it's something that they like or don't like. And, like the pressure to get it triggered,
Oh,
that type of
yeah,
stuff.
yeah, yeah.
I'm
So
looking
we're
for like
talking about the odors.
no odor versus like,
A
BV
odor.
shame. Yeah.
Well, our culture has gotten to the point where we sell so many things over at the drugstores or wherever you get your soap and stuff from, that to put on the vagina to make it smell not like a vagina. And so that we've gotten to the point women don't really understand what a vagina should smell like.
Yeah.
And then their partner don't understand what it should smell like. And so then after you put all that stuff on it, and then one day you run out of it and you don't use it, it's like, oh, you have an odor. you
I
know
mean, but so tell
that's
me
terrible.
what is it supposed to smell like? If you had to try to put together a vaginal fragrance, because we've smelled as midwives, we smelled a lot of vaginas.
Okay. When we smell it, when are we doing this thing where we're looking at it? How does it smell right after the baby? How much does how does it smell like?
Right
It's-
after the
you
baby,
know,
right
yeah.
after the
So
day.
after the baby, for me, I think after the baby, it's just fresh blood.
Yeah.
It just smells like fresh blood to me, and that's not troubling for me. Outside of that, if I'm gonna say, like, that's me just repurposing what I was gonna say. I was like a mild version of the hot scent that you get when you go to the gym. Like, you know,
What? Clear that up for me.
it just it's like a mild version. I don't know. Somebody is gonna come back and tell us what that is. But you know what it is when you smell. It's just that's terrible. Then I never thought about it like that. But you know what it is when you smell it. You're just like, oh, okay. But to tell somebody, everybody's vagina is gonna smell different,
Yeah,
right?
right there's a spectrum or like a range of scents.
And it's gonna smell different after she have a baby, and sometimes after each baby, and when you hit perimenopause, and when you're in menopause. And the teenagers don't smell like women that are having sex and all. They're going to be different too, um, because of the pH is different. And so as we try to narrow it down, and have conversations about it with women, and having them feel like it's okay to talk about it, because you got to do something about it if you got bad odor, but you don't know if you have a bad odor because you used all of those strawberry washes down there, and now you think that's what it's supposed to smell like, so you running in, you want to go be seen because I have an odor. And when you when you have somebody say that they have an odor, and you step out of the room, you have them take their clothes off, and then you come back in the room and you don't smell anything, and you're like, well, where's the odor?
Right.
You know,
Gotta
they
be
should have met me at the door. Yeah, usually to meet you at the door.
yeah.
And so You're like, there's no odor,
Sometimes,
and even after.
saying it could be brewing a little bit, right? So, like in the case, like you were saying, like if there's some like bleeding from the cervix or something like that, it can mask it at lower quantities, right? Because the pathogen, what's the name of the pathogen that causes that is
causes
responsible for
causes which one?
bacterial vaginosis?
Jess was looking
Or
at
the
it.
most
Hold
common,
on.
the most common. I, that is so far gone out of my head. I
There
think.
was
Right.
a meme. Hold on.
Is it
Uh,
okay? So I know that
uh,
Albicans is the most common yeast strain, but I cannot think of the most common bacterial vaginosis overgrowth. I
I was
can't
just um. It's saying it's mainly lactobacillus.
lactobacillus.
Yeah,
Okay, so
mainly.
for me, I feel like in general with overgrowth. So I also have a lot of clients now too who will do, um, like lotus, like full lotus birth. So not just having the baby be born attached to the placenta, but like keeping it attached until the cord falls off. And one
You
of the
said
main
what
things
about it? You said what about that one?
I have a lot of clients, like it's getting more and more popular in the clients that come to me that they want to do that with their babies or whatever. And outside of the risks versus benefits, the polarizing conversation that we could potentially have regarding
You talking about like a you mean are you saying like a lotus birth
like a full
or
lotus. So the
oh
lotus birth is where the baby is
they're
born
just
with the cord attached, which most home births usually wind up doing anyway.
okay. Okay, I
However,
understand what you said.
some people want to do the full lotus, like don't detach the baby from the placenta at all, right? Until it falls off the body, right? So the whole thing will fall off the body at one go. And what I tell people is that, you know, like usually you put salt over it to dry it out, but that you also will put herbs over it because
And oil.
to putrefy, right? Like if you don't treat it with some like antibacterial, antimicrobial herbs, and maybe some fragrant herbs, then it will smell. It will start to smell like a lot of bacteria.
Tina sells the kit, a lotus birth kit.
Yes, so we're talking about this. So this is Gracie Diola's on Etsy, which check her out. If I know she was selling a lot of stuff, and I'm not sure if she
You
actually
talking
did.
about Tina Brahma?
Yeah,
Yeah, she's on Etsy.
right.
Gracie Diola. Gracie Diola is the name of her store over on Etsy.
Yes, and
Mhm.
so there are herbs that you can use, but that's the reason why you would use them, right? Because if you don't do something to bring down the quantity or slow down the multiplication of all of the bacteria,
The meat is pretty much decaying.
exactly.
Um, yeah,
And
and
this is
so
what I think. This is what happens, like on our body, if we don't wash it, right?
yeah.
This
Hmm.
happen anywhere, you know. And so I think that especially when we're talking about vaginal washing, like some people are very much like, I don't really even use soap, or especially not fragrance soap, like on the rest of my body, and are moving more toward using non-scented soaps or not using soap at all, and especially
Right.
on the vaginal area, right, like the external.
I'm not sure you should be using any soap down on your vulva. I mean, I think water is good. Water is good and mild itching. Um, the
Here's the thing.
apple cider vinegar and water rinse, but that all of that soap is not good.
Exactly. Well, so here's the thing though, but most people will do that in order to extend the amount of time that they go without having a more fragrant vaginal discharge, right? Like, right, or just because even if you don't have discharge, like that area
And did you say fragrant?
odorous. Yeah, but
Fragrant
it does. It
from
becomes
the
more
inside,
fragrant.
from the inside down, or what are you talking about from the outside? What are we talking?
I'm talking about period. Like the longer you go without rinsing or washing, the more the odor will build up. So, and I'm not saying that
Uh-huh.
it necessarily is a bad odor. I'm just saying odor in general, right? Like what it smells like.
Yeah,
So,
yeah.
if you don't use any fragrances, you don't use any soaps, it's going to be quicker to smell fragrantly, um,
Naturally.
whatever yours smells like, and
Hmm.
um, and it's probably going to be like with just more fragrant than if you were to use those like the soaps and stuff like that. And so I think
Well, if you if we're gonna go back and get into BV,
yeah.
and I have seen my daughters, um, they buy these different washes and all these things, and I've told them that it's not good to do a whole lot of it.
Mhm.
Like you're gonna wash in the shower, and I just can't make them not do it. They're gonna do it, and you want to do it using in the shower. But now you got the small little version that you keep in your purse, and the wipes that go with it. And so all day long, every time you go to the bathroom, you
It's
spraying it on. Like it
yeah,
just, yeah, you just keeping it going, and then you wonder why you keep a BV.
yeah.
Yeah,
I mean, 'cause it's a
you keep
balance.
BV.
There's
Yeah,
a balance. There's a balance, right? And it's very easy to offset that balance when you
yeah,
keep trying to apply something to change the way that it's supposed to that it naturally is.
yeah, yeah. So you don't have the natural pheromone smell, especially from like in the growing area underneath the arms. People having their natural odors that they smell like even without them putting on deodorant. And so if
Mhm.
you get to the point of now the deodorant, they're making the deodorant that you put in. I guess you're supposed to put it in the
I don't
growing and
know
not
what you're supposed to
not
put that.
on the vagina.
Yeah, I don't
Huh?
understand that. I don't know why. I don't know where you're supposed to put that at. Like, are
Exactly.
you really supposed to be like, how you would like right in between your arm, like
So,
under
so you get it up in there.
people to
You
do
got to
that?
get it up. You got to get it up in there. But it's like- and
Wow,
then if you have really big thick thighs, and you put that in your growing, even on the side of where your panty line would be, it's still gonna fall
it's going to.
onto the vulva,
Yep.
and you know, and that's a potential problem.
I mean, especially if it has antiperspirant in it, because even if, and I don't know if it does, I don't know what the total body of deodorants and like, the things that are branded or put on the shelf. First of all, not everything that's put on a shelf is meant for you to put on your body. Like they are just
Yeah,
the government or the stores allow for them to market those things does not mean that they are necessarily the best thing to do. And I get
yeah, and you don't even know if it has aluminum in it or not.
you don't know how your body's gonna
Yeah,
respond to
yeah.
it unless I mean from somebody who's done some things and regretted it, like you have no idea how your body is going to respond to this item. And the last thing you want to be doing is having some like like angry rash going on down there
I
introduced to your skin and
a
stuff.
funny story. I had a the first time I ever had a yeast infection. I didn't know what it was, and I put water in it. I bought
Inside,
a
you
douche.
got poured
I
in.
bought a douche. Yeah, I bought a douche, and
Ah,
you put water in it. And by the time my aunt came home, I was in tears. And
not water.
we don't. We have to
Ugh,
educate our girls. That's the other thing we
yeah.
talked about. We have to educate our girls of what is normal and what's not normal, and what do you do, because by themselves a lot. And so then something happened, and you go do something tragic like I did. Why would you put water in it?
So what happened there? Tell them why not. What happened when you put water in there?
I fed it.
Mm.
I fed it's yeast. It loves
Also,
water.
this is also a pH issue, especially when it comes to BV specifically, like for sure, right? Like this is the pH issue, and water has its own pH, and it is not the same
Hmm.
as the
Right.
vagina. So any
And then doing it more. Right.
yeah,
Yeah,
yeah, you
that's
got
more. So that's gonna knock it off. Wearing your sweaty underwear,
to
um,
here's the time. Yeah,
and wet bathing suits and things like that. Not
definitely.
not clean, not wiping up after sex.
Now this gets back to a little bit like normal odor versus BV related odor, but when it comes to and kind of back to sex, right? When it comes to sexual intercourse, I think we should talk about like how semen, of course, can affect the
Hmm.
vaginal pH. I feel like very often what people do is they smell an odor and they're like, oh my God, no, get me out of here. Like, you know what I'm saying? Like, you need to send me,
I don't think semen is friendly to the vagina unless you're ovulating, because then your pH changes,
everybody's ready.
and
Exactly.
it don't fight it off. It don't fight it.
Yes,
They become friends doing sex.
exactly. They're
So
complementary
yes,
when your body is ready to have sex. But outside of that,
just
we trying to be
yeah, you have
traditional.
a problem. You could have a problem, but yeah, but with you, when it has to, because otherwise your body it creates that mucus and everything that don't even want to let the sperm go up. And so,
Exactly.
but when it's ready, it's like, oh, I'm ready. Let's come on, let's do this thing, and now they're friends. Yeah, now they're
We
friends,
ignore
and
that
you don't
all
have a
the
problem.
time, though, right? We ignore
Right,
that all
right.
that our
Oh,
bodies, like even though we like to have recreational sexual intercourse, that our body is not always in a position to accept that
mm-mm.
gracefully or with the same grace that it would when we are ovulatory, right? Like our body is changing at that time and
Right,
getting more susceptible or more likely to invite semen in a natural fashion. And so I think that what I've seen commonly done is that after sexual intercourse, and especially if you are having sex like every day or multiple times a day, it's just more likely to throw your pH balance off. Now, the alternative, which not everybody's going to want to do, is to not have sex every day, all right? Or you know what I'm saying? Be mindful that if you do have sex outside of your ovulatory window, or when the conditions aren't necessarily the best, that usually all you have to do is maybe wait a day or so. The odor will change. Like it will normally just right itself.
well, the semen is one issue, but you go back to your over the counter products for lubricants and
Hmm.
moisturizers. And so then it just becomes a bit more crazy when you start looking at all of these different products, you know, mainly baby oil. I just didn't even think people did that until I saw this thing with Diddy. But I didn't even think people put.
Right, but I didn't think they were using it as a personal lubricant. Were they just putting it on the body, their bodies and stuff, trying to slide off their bodies? Tell me how they
Oh no!
use
Instead, he had a
it.
whole bottle of.
No, we have to talk about that part. They was putting
I
it on their genitals.
don't. If you grease somebody down enough and you going from head to toe, you just gonna skip the vulva. You gonna grease them all the way down. It's in there. And he greased
God,
down and she greased down, and then you want to keep it going. So you about that sticky and tacky Astroglide. It's the worst. That is the worst thing. One of the worst things you can put in the vagina.
it
What you
is.
got? Astroglide, KY jelly, the worst. So,
Okay, so let's talk about some of the best because I actually just got some samples to
oh,
from one that
I
I like.
don't have anything. Um,
There's this brand. I don't know. We should probably
I
shouldn't
had
mention.
another one somebody had sent me
I think
that
in general
was
we could just say water-based lubricants before I start pulling up samples and stuff
a
like that.
million.
Water-based.
Fexi is a birth control. But it's a you can use it as a lubricant too.
Mhm.
And so I don't know. Have you ever seen Fexi?
Yeah, I've seen it.
Yeah, yeah.
I've
And
seen it. I'm
so
not
it's
gonna do
kind
it.
of thick. It's kind of thick, but with penetration, it should melt inside of the vagina. It should melt, and then you have some lubricant there. But yeah. You
We was
said
talking about coconut oil though and olive oil.
olive oil.
I mean, you
Yeah,
want to take
those are good. I mean, but they're not condom friendly. And so then if you want to find something that's condom friendly, then you go with, like you said, your water-based lubricants. And they have the other ones that are good for trying to get pregnant, like pre-seed.
Mhm.
And those types of lubricants, because they're not going to kill the sperm. They have to swim. And so when you think about what you're putting in there and say, well, I'm not pregnant. And so while you're not pregnant, and the other thing about not being pregnant and using lubricants is having oral sex when you're ovulating. And
Mhm.
so that oral sex when you're ovulating, it's like, oh, it's gonna get me to where I need to be. And so you can have your own personal lubricant, but the saliva can kill everything too. It could slow it down, and you need so many million a sperm to get pregnant, and so you don't want to be just killing like 10 to 15 million of them. You need 25. You need 25
You need
million to get.
25 million.
You need 25 million and to get pregnant.
And you still
If
well,
you done knocked off 10 to 15 million of.
just
That's
what you
what
want.
I'm saying. So, what happened? What was happening? I mean, we have oral sex. People think oral sex is just, it is what it is. We do oral sex all the time, but not understanding that it knocks off,
Yes, interesting.
everything too. So you just have to be careful now. And when what you're having sex, what's the reason why you're having sex? We're just having fun. Great. We're trying to get pregnant. Different. We just had the baby. Different. So your postpartum mamas, they got a problem too. Um, with vaginal dryness and arousal.
Yeah,
Uh, and so not all of them, but if you're nursing, that could be a problem. That could be a problem,
it can be.
and that's frustrating. That's frustrating, especially for like a first time mom.
That's the
And
hormonal stuff, though, right? Like we were talking about with like perimenopausal women, menopausal
mhm,
women.
yeah,
Um, sometimes your hormones change, like they will fluctuate throughout the month. Same thing.
yeah,
Your pH is going to change.
yep. But and your odor could change,
Yep.
but it shouldn't just be just fishy and loud, you know. And so once you understand, okay, there's nothing wrong with me here, that will necessitate going and having one of those exams that I hate. I don't want to be laid on my back. Oh, I don't like that at all.
Yeah.
I gotta be laid back and put my feet up in stairs, and I don't like that.
So look, I
It's
don't even
just
use stirrups, but it's still not that It's not still not the most
well,
comfortable thing.
still, if you telling her to put her feet together and drop her legs like a frog, that's not a good position you want to be in with somebody that you're not about to be intimate with or whatever. It's just like
True. Now, what
then
do you
we.
think about self swabbing though, especially for like
Oh yeah, I
vaginal,
believe that
right? Like
they have a
you
they
just
have
need
a new they have a new device I saw yesterday. I can't remember the name of it, but it has the swab. It's the swab fits inside of it, and it's a bit more stronger than just that stick,
hmm
and it's for self swabbing for the pap.
yes, 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 yes.
Yeah. Now
When we go,
self swabbing for GBS and all the other ones. I'm all for it. I just didn't understand how you get to the transformation zone
man, I don't know
by,
either.
by just letting her do it herself, because sometimes we have a hard time finding the cervix
When you
with
try
a
to look
speculum. I'm
yes,
like,
yes,
I'm like, well, if that was the way to do it, why would you teach anybody to go in and travel around and
I
put your
mean,
hands under your or put your fist under your booty and do all of these acrobatics just to get to the cervix?
what I will say too is that I have had it. There was a time when I was like earlier in my practice and I was just starting out where they told me I didn't even get they couldn't find any cervical cells. I said, what? And I was there. I'm looking at it.
And she went all the way in.
I had to repeat it.
She went all the way in that cervix.
I mean, it was
Did you
me.
see it?
I thought I did. I thought, yeah, I was in there.
You did it.
Heck, I did it. And so, if that's the case, if that can happen when I am right there and I'm there with a speculum,
You sure it
they didn't
wasn't?
have that
You
cervical.
sure it wasn't a fold of tissue that you thought
I
was the
mean, I'm not
cervix?
sure what it was. They said one on cervical tissue. So I'm saying if I'm standing there looking at it, I mean,
And,
I was
and
so
in the wrong
so
spot.
early in my practice, like I hadn't necessarily identified a bunch of cervixes in my life, right at that point. And so I can't. I'm not gonna be like I was there. I know for a fact I was there. You know what I'm saying? They said it wasn't on cervical cells. What I'm doing, but for somebody who was looking and swabbing versus somebody who's not looking and swabbing, what are the chances that they're gonna? get the sample that they need in order
Well,
to.
I think it's impossible to hit the transformational zone just by just blindly going in. But what these tests are looking for is anything that's floating around
Mhm.
in that area that you're just not going in there. But um, it takes away from actually putting your eyes on that cervix too. So sometimes you can see things with the cervix when you go in and you do the pap. You can see redness, you can see blood, you can see things. You're like, oh, this it's no, it doesn't look normal.
Cysts, that's a big one. I've
You
seen,
say
I've
you
seen
say which one? What's the big word?
cervical cysts. I was no, what a big word.
Cer- Cervical cysts, polyps.
Yeah,
Um, I've seen. You need to go in there. When you do
at
that
some
pap,
point,
you can
yes.
see.
At some point.
You need to go in there. You can see gonorrhea and all of this stuff. The fluid is just sitting back there. You can see all of that stuff, and so I guess the swab pick up because you just gonna get all this fluid, and it's gonna get it too. But sometimes you just see it right then and there, and then to say, "Hmm, there's something else going on here."
Yeah, because I mean that's what I mean. It's cervicitis, right? Is what it is. What
Yeah,
the S
yeah,
stuff like
a
that. So
cervicitis or
the cervix,
what's the other herpes? Herpes and stuff. You got sores and
which
and
I've never
all.
seen an internal herpes outbreak before,
I
but
have,
I'm sure. Have you?
I have, and the poor woman could hardly walk.
Dang, that gotta be painful.
And it was the first outbreak, and it was everywhere. It was on the vulva. It was on the vaginal walls. It was.
I'm surprised she even let you go in there to look with the speculum. She could
She
see it.
had she had she had to come. She had to come to see because she could hardly walk, and she had these sores, and she had to come to be seen because she wanted to get to the bottom of it.
Yeah,
Yeah, that was hard. She cried the whole time.
man.
That was I was a student. I was a student, but yeah, that was hard. I was like, "Oh, I don't want to see nobody coming in like this. This is so
Yeah,
that's hurtful.
it's
It,
hard.
it just it hurts your spirit, you know.
Yeah, it's hard to even when you don't have all of that going on, like you said, don't nobody really want to do that exam that much. So
And you know that somebody done that to her. Somebody gave her that. You know, that
mhm.
wasn't something her body was an autoimmune thing or anything. Somebody did that to you. You know.
So for BV, anything else that we want to share?
I
Anything
think
that we didn't cover yet that we talked about the other night?
we talked about that. We talked about the girls having visits with OB and midwife, and they
Yes.
get their menses. Mhm. And knowing how to care for it.
Yes.
Um,
Well, we actually didn't really talk that much about that because I feel like that is super important, and maybe that's something that you could come back
we
on
talk about
with me
okay.
about because I do think that's super important. Is like people usually go when they have a problem to see one of us or an OBGYN, and there are so many things that you might be able to prevent, so much strife and anxiety that you might be able to avoid or at least decrease by having a conversation with
Hmm.
a midwife. Like you can
Hmm.
definitely
Yeah.
once you start your period, once you get to the point where you are interested in starting a sexual
Yeah.
relationship.
And definitely if you're going off to college or something,
You go because you might think you're gonna continue to be a virgin, and then somebody
or you get married,
change your mind,
or
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 you
or you are a woman, or you're a woman that has been celibate for a long time.
get
If you haven't had any sex since you were 40 and now you're 60, 65, and you're getting married again, you might want to come see somebody to help you with that because that could potentially be an issue because
your
of
body
the
your
everything, and
body.
it's just going to atrophy. And so atrophy is real. People say if you don't
What you
use
mean
it, you
by
lose it.
atrophy? What is it? What do you mean by that? What can happen? I'm 40. I stop having sexual relations. I start up again sometime after menopause has been active in my body for a few a decade or two. Like, what can happen? What can it feel like?
So then the the vagina has on the walls, it's like we'll say rugae or folds,
Mhm.
similar to the way testicles look, and it helps to provide lubrication as well.
Mhm.
Well, as you go through menopause, those walls with all of those folds and all, it becomes really smooth. And so now that's smooth, and so goes your lubricant.
Mhm.
Not all of it, because you got your Bartolians and all of that that help
Right.
if you get aroused in that way. But
Yep.
for some people, they are aroused by penetration. But that when you have sex against those smooth walls and decreased lubricant, that can be very painful, and it don't stretch no more.
Yep.
So it's not stretching, and so you haven't put nothing in there, so it's not stretching. And so now you need to go see somebody to help you get it stretched back out to a point where you can have sex.
Use it that way. Yeah.
Yeah. So I don't know, if you going, keep going. Things happen, spouses die, and all these other things happen. You get sick. But you'll need to go see somebody about that. So we don't we don't talk enough about arousal problems and all that women have. Women have problems too. And we don't talk enough about why did that happen like that? Why am I having difficulty like that? You can have lichens, lichens, and
Yeah.
all of these things that cause problems. Like, what in the heck is a lichen?
Exactly. Exactly. So, and I mean, we way off topic now, but I've seen a fair amount of lichen sclerosis, and
Oh,
um, I can
that's
say
hard.
so. I mean, what I didn't know until I started to research it because somebody in my family had it when they were very young, um,
Oh,
is that 15% of the cases of lichen sclerosis occur in young women, and then
get out of here.
we're gonna have to talk about that when we talk about yeast because baby, that's one of
Okay,
the common
get out.
misdiagnoses for people who have lichen sclerosis. So it's a pediatric condition in 15%
Hmm.
of cases. Is the estimate. It's just very, and that's probably an underestimate. It's probably very underdiagnosed. It's oftentimes sort of like brushed off as um, a yeast
It's
infection.
because it itches. Yeah, because it's itching.
Exactly. And
Yeah.
then it might recur, right? Like it might just spontaneously improve and then recur throughout adolescence. Um,
Hmm.
then maybe lay dormant for a while and then come back later on in life. So that's the most common way is that
Oh, and
yes,
and then it became dormant.
exactly. And I've had
And,
clients
and
who report that they had it since they were younger before they ever started having sex. They had it when they were younger, and
now it's itching, and you can't even get in there. So now we gotta give them something to help with that. That's the
man,
worst. I thought the worst itchy thing was yeast infection is pretty itchy because of you know it just makes your skin all red and painful.
yeah. But I
Yeah.
mean, get see somebody, see a midwife, see an OB, see a primary provider before you start sexual relationships, before you make major life changes. I mean, it could be as simple as like changing the like maybe you're sensitive to latex, like changing your condom, like anything.
Oh,
Right?
or all the way down to the point where I want to get pregnant. I want to make sure my body is in the healthiest position to
100%.
achieve pregnancy and have a healthy pregnancy.
Yes.
You know.
Save you a lot of stress, a lot of strife. But also come see us if anything else occurs, anything, any odors, any pain, that type of stuff. Because not only do we kind of sort of suffer in silence when it comes to odor, but there's a lot of stuff like no, not orgasming, right? Ever, like never getting to
Oh,
that place, having painful sex. Like there are tons of things that
yeah.
that we can help guide you through. So thank you, Cassandra, for coming on. I'm gonna
No
definitely have
problem.
you back sometime because we got a lot of other stuff that we could talk about. And
Well, that'll work.
yeah, okay, good.
All right, my dear. Well, but thanks for having me.
Absolutely.
Okay.
Thank you. Oh,
And
I'm learning great info. Is what Mr. Green said. So good. I'm glad. I'm very, very glad. All right, y'all. See y'all next week.